Here are 5 USMLE-style questions focused on genetic disorders by chromosome, including Wilms tumor, beta-globin gene defects, sickle cell disease, beta-thalassemia. Question 1. A 3-year-old child presents with abdominal mass, hypertension, and hematuria. The child's family history reveals that the mother had a history of Wilms tumor at age 4. Genetic testing reveals a mutation in the WT1 gene located on chromosome 11. Which of the following is the most likely diagnosis? A. Wilms tumor, B. Neuroblastoma, C. Retinoblastoma, D. Hepatoblastoma, E. Adrenocortical carcinoma. Explanation. Wilms tumor, nephroblastoma, is a common childhood renal malignancy associated with mutations in the WT1 gene on chromosome 11. The characteristic features include an abdominal mass, hypertension, and hematuria. Family history and genetic mutations are important risk factors, and the WT1 gene is involved in kidney development. Question 2. A 25-year-old African American male presents with severe pain in the hands and feet, along with fatigue and anemia. Laboratory tests show a hemoglobin electrophoresis result consistent with HBS. His family history reveals several relatives with similar symptoms. Which of the following genetic mutations is most likely responsible for this patient's condition? A. Oglobin gene mutation, B. Baglobin gene mutation, C. JAK2 mutation, D. Factor V Leiden mutation, E. CFTR gene mutation. Answer: B. Beta-globin gene mutation. Explanation: this patient likely has sickle cell disease, which is caused by a mutation in the beta-globin gene on chromosome 11. This mutation leads to the substitution of valine for glutamic acid at position 6 of the beta-globin chain, HBS, resulting in sickling of red blood cells, vaso-occlusion, and pain crises. Question 3. A 9-year-old child with a family history of hyperparathyroidism, pituitary adenomas, and pancreatic tumors is diagnosed with multiple endocrine neoplasia type 1, MEN1. Genetic testing reveals a mutation in the MEN1 gene on chromosome 11. Which of the following is the most likely clinical manifestation in this patient? A. Cushing syndrome, B. Hypercalcemia due to parathyroid adenoma, C. Pheochromocytoma, D. Medullary thyroid carcinoma, E. Acromegaly. B. Hypercalcemia due to parathyroid adenoma. Explanation: multiple endocrine neoplasia type 1, MEN1, is caused by mutations in the MEN1 gene on chromosome 11 and is characterized by hyperparathyroidism, pancreatic neuroendocrine tumors, and pituitary adenomas. Hypercalcemia due to parathyroid adenomas is one of the most common clinical features of MEN1. Question 4. A 4-year-old child presents with anemia, splenomegaly, and recurrent infections. Genetic testing reveals a point mutation in the beta-globin gene. The patient is diagnosed with beta-thalassemia. Which of the following is the most common genetic abnormality responsible for this disorder? A. Deletion of beta-globin gene. B. Point mutation causing a splice site defect. C. Missense mutation leading to HBS. D. Increased expression of I-globin gene. E. Chromosomal translocation involving chromosome 11. B. Point mutation causing a splice site defect. Explanation: beta thalassemia is most commonly caused by point mutations in the beta-globin gene on chromosome 11, leading to defective beta-globin production. This can result in anemia, splenomegaly, and recurrent infections due to ineffective erythropoiesis. Question 5. A 35-year-old female presents with recurrent miscarriages, menstrual irregularities, and a family history of pituitary tumors. Genetic testing reveals a mutation in the MEN1 gene located on chromosome 11. What is the most likely diagnosis? A. Multiple endocrine neoplasia type 1, B. Multiple endocrine neoplasia type 2A, C. Cushing disease, D. Hyperparathyroidism jaw tumor syndrome, HPJTS, E. Neurofibromatosis type 1 NF1. Answer: A. Multiple endocrine neoplasia type 1, MEN1. Explanation: this patient likely has MEN1, which is an autosomal dominant disorder caused by mutations in the MEN1 gene on chromosome 11. MEN1 is characterized by pituitary adenomas, parathyroid hyperplasia, and pancreatic neuroendocrine tumors. Recurrent miscarriages and menstrual irregularities can be associated with pituitary adenomas or other hormonal abnormalities in men 1.